Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about volunteering for the Visiting Nurse Association of Cape Cod. Today we are lucky enough to have with us two people. We have Gayle Johnson, who is the volunteer specialist for the VNA, and she has brought with her Delaney, who is one of our hospice volunteers. So thank you so much for being here. I appreciate your time.
Thank you.
This is always fun, especially if we have a few extra people, so this is good. So Gayle, I'm going to start with you. Always for the new programs, I like people to get a feel for who the person is and how'd they get here. So how long have you been with the VNA, and what interested you in volunteer programming?
I've been with the VNA for 5 years, and before that I was briefly at the hospital working in the VNA, in the hospital volunteer office, and before that I was volunteering at the hospital. And I realized that I really liked working with volunteers and the concept of volunteering, and I was lucky enough to be able to come to the VNA to work with their volunteer programs.
Nice. So had you retired, sort of semi-retired, and decided to do some volunteer work, and then one thing led to another? Or?
Well, sort of. I wasn't really retired. I had sort of was taking time to figure out what I wanted to do here on the Cape.
Nice.
I had worked for a building company, and it was during the recession, and I was laid off, which was great because it was an opportunity for me to think about what I really wanted to do.
They say that happens, right?
Yeah.
The door closes, the window opens,
yes.
vice versa.
Yes.
Yeah. And how about you, Kay? You've been volunteering with the VNA for
4 years.
4 years? Mm-hmm. Were you volunteering someplace else before that? Or?
No, I moved here about 4 or 5 months before that.
Oh, okay.
But I knew I wanted to do some hospice work, and I saw an ad in the Cape Cod Times about the classes that Gayle was holding.
Excellent.
And so I signed up.
Did you know anything ahead of time about the VNA or?
Well, I'm a registered nurse, a retired registered nurse, so certainly aware of it. And
So
I'd been a home health aide before I was a nurse for a visiting nurse association in another state. But
so you had some inspiration to begin with.
Yeah.
Yes, very good. Gayle, I'm going to go back to you and just talk a little bit about why do you think people volunteer?
I think people volunteer a number of reasons. I think people volunteer in order to give back to society and help with the greater good. When you volunteer, you just get so much more back than what you actually give as far as gratification. Some people volunteer because they find that they have a lot of time on their hands and they would rather do something to help someone than do nothing.
Right. It gets people out into the world a little bit more as well. Yeah.
It's a benefit to both the volunteer and the organization that they're helping.
Yeah, definitely the organization. It does seem like on Cape Cod especially, and maybe every other area as well, there's such great opportunity for volunteers because there's so many nonprofits around and that are always on the lookout for that population and good volunteers.
Yes.
Now there's a lot of different opportunities available at the VNA for volunteers just by the nature of the organization. So you want to touch on some of those?
Sure. We have on Route 28 in South Yarmouth, right near the Registry of Motor Vehicles, we have our VNA Thriftique, which is our thrift shop. And the thrift shop often needs volunteers. Right now we need volunteers for cashiering. It's a wonderful place to visit, but also to volunteer. It's a great, fun-loving group there.
Yeah.
We have volunteers in our child care center, which is in Falmouth.
Okay.
And those are for people who are interested in working with young children, reading to them, helping play games, helping set up for snack time. Or
so anyone that had an affinity for children, that would be a good area for them to go.
Yes,
And
definitely.
then just to back up to the thrift shop, is that every day as far as hours are concerned? What are their hours? Just to give people a sense of what might be available.
The thrift shop itself is open from 9:30 to 5, and usually there's a morning shift and an afternoon shift that the volunteers work. Some volunteers will work 2 shifts a week. Most of them are 1.
Oh, yeah.
Depending on what the need is and what the availability of the volunteer is. And some of the volunteers sort clothes. As the clothes come into the back, or all the items come into the back room, and then they go into the middle room for a second looking over of sorting. And there's a group of volunteers who sort and price and hang up clothes, and another group that takes care of housewares.
So even within the thriftique, there's a lot of different choices.
Yes, yes.
So if people
yes.
didn't necessarily feel comfortable up at the cash register, they could be behind the scenes and doing all that work without ever being seen at all, if that's their preference, right?
Yeah. Yes.
Oh, good.
Silver.
Yes, or
Polishing silver.
Yes,
Nice.
yes.
You get silver at the thrift shop,
Yeah,
right?
we do quite a bit.
Wow,
Yeah.
that's great.
Yeah.
Okay, so we have, so we touched on the thrift shop, childcare, and that's down in Falmouth.
We have 2 adult day health programs, Compass, which is in East Harwich, and Trade Winds, which is in Sandwich. And both of those facilities have volunteers that help with the clients.
With the clients. So for the adult day health, that's kind of like childcare, only it's for adults. So it's adult daycare, but it's a
adult
medical
day program.
Yeah.
And there's different activities that every day has a different schedule, and there's discussions of current events, crafts, some exercise that the volunteers help
that they
with.
can help with. Yeah. Now both childcare and the adult day health programs are Monday through Friday.
Yes.
Right? Okay, so no
Yes.
weekends. Thrift shop would be
They're open Tuesday through Saturday.
okay. So if people wanted to do something on the weekend, that would be a good choice for them. Then we have just other administrative help
We have
for the
administrative
agency.
volunteers. We have them and need more in the hospice office in South Dennis. We have them in the Hyannis office, helping with marketing, putting together admission packets, helping with filing.
And those locations you said were Hyannis and Dennis?
Hyannis and South Dennis, yes.
Because
Yes.
those are the main offices for the agency, for the administrative part.
Yes.
Okay. And then there's always the hospice volunteers,
Yes.
which we'll get to that in a minute because there'll be a lot to say there. But all of those areas, do you feel like there's a need for viewers that maybe tuned in and thinking this is sounds like fun?
Yes.
Any one of those areas you still
all
have a
of them,
need?
Yes. And the hospice volunteers, there's a training that hospice volunteers go through, as well as a health screening, and the Medicare has a lot of guidelines as far as what's included in a volunteer educational program for training volunteers, and it helps them prepare for the situations they'll be volunteering in.
Yeah. They'll be more comfortable doing what they're doing.
Yes.
Yeah.
Volunteers are just a wonderful resource for patients and family in hospice.
Great. Now, do volunteers need any kind of special training or ahead of time?
No, not ahead of
anyone?
time. We provide the training and the health screening.
So depending on what area they decide to go to, they'll get on-the-job training at that time?
Yes.
Okay. So if they had background in a particular area, that would probably make their life easier if they came out of an office. I know there's a volunteer in the marketing department, and I think she was in an office and does now some volunteer work in the office, so that's been a good fit for her. Yeah. Okay. Now, what about number of hours? Is there a requirement for volunteers?
Typically, it's 3 to 4 hours a week. And depends on the need. Some departments might need, if it's administrative, someone once every other week. But typically, whether it's hospice or the thrift shop or adult day health, it's 3 to 4 hours a week.
Is that self-directed, or is that just an agreement the volunteer makes with whoever they're working with the manager of the program? So if they say, oh, I can only work 2 hours this week,
yes,
that all works
Yes,
out.
It's very flexible.
All right.
It's very flexible. Some of our volunteers are snowbirds.
Okay.
And they're only available spring and summer.
All right. So then they have we cover for them in other ways while they're gone.
Yeah.
And then they're welcome to come back.
Yes.
We keep them even though
Yeah.
they go to warmer climates while we all stay here in the snow and the cold. What about teenagers? I know there are some teenage programs out there that are looking for places to volunteer. Do we?
Yes, we do have, and we welcome teen volunteers. The thrift shop in the summer is very, very busy, and that's a great place for teenagers to volunteer. They can also volunteer year-round on Saturdays at the thrift shop.
Oh, right. I would think that would give them some kind of good work experience to go forth for real jobs.
Yes, yes. The adult day health programs in the summer have had teen volunteers. So that's a great place too.
Yeah. So they could find out if they were interested maybe in the medical field. Is it a nice way for teens to learn the industry in general?
Yes, yes.
Yeah. So now, Kay, for hospice volunteering, that's a little more in-depth, sort of unique situation as far as volunteering for the agency. Now, there's additional special training, and I'll let you both talk to these questions, but there's additional special training for hospice volunteers.
Yes, and we had speakers that were a registered nurse, the bereavement counselors, the chaplain came and spoke to us to give us an idea of some of the other people that are involved with the care of the patient in addition to us.
So the training program, maybe Gayle, you could speak to that, of what's involved. So if someone comes to you and is interested in being a hospice volunteer, what's their next step?
Their next step is we would talk and discuss the volunteer program, discuss when the next training will be. The trainings themselves are about 24 hours, and typically it's 2 days a week for 2 weeks, and then a half day, which is part of the Cape Cod healthcare orientation.
Okay. All right. And then some of that training is what you just spoke of they get to hear from all the different team members that are part of hospice.
Discipline.
So does a hospice volunteer interface with all the other team members? So you have like the nurses, the social workers, the IDT meetings. Is that something volunteers sit in on, or
not
are they
typically?
Not so much?
But you they're available. I've had some questions that I wanted to talk over with the nurse, and it was very easy to go through the office, and then they would contact the nurse. She'd get back to me if I had a question, something that I had observed while I was in the home that I wanted to see.
Yeah.
What was really going on with the patient, or if there's something more I should expect from them, or less.
Oh, yeah. So let's just tell us a little bit what you do as a hospice volunteer. For a viewer that might not have any idea, what would your typical, even though there may not be a typical, so you can give us a couple different examples of the kind of things that you do as a hospice volunteer.
Basically, I think the biggest one is to sit with the patient, be there, present in the home, so that they don't feel alone when their family member or caregiver of some sort needs to leave, to go shopping, to go to a doctor's appointment, just to get away for a little bit. And that also gives the caregiver some good feeling that they know that there's someone there for the patient. They're not going to be alone, because that's really important. And sometimes they're awake and alert and conversant. Some people, I just go there for companionship. There is no caregiver, but she wants to talk to somebody and not be alone. I've done some grocery shopping for a couple of different patients.
Oh, nice.
Because they had hired a private caregiver, and they wanted her to stay with the patient, but they had a grocery list that needed to have filled, so I went grocery shopping, which was kind of different.
On somebody else's dime. That's fun.
Right.
Take the list?
Yes.
Great.
Off I went.
But that's a nice break, or something off the mind of the caregiver.
Right.
They want to be home with the person that they love, and yet they need to have these sort of necessary things taken care of, so that's something that a hospice volunteer can cover for.
I've also sat with an actively dying patient whom we did not want to be alone. And in some cases there was no family, and it was important. And especially in nursing homes, the staff were incredibly grateful because they got to know this patient and they didn't want him to be alone. They'd stop in and say, thank you for coming, and sitting with them.
Wow.
Sometimes a family member was on their way from a distant town, and so I would stay until the family got there,
Oh, right.
or until someone else took over from me.
Right.
And that's kind of a special time, but it's just soothing talk, maybe a little touch, but just being there, because we feel that nobody should have to die alone.
Right.
I have a very strong feeling about that myself.
I bet. Yeah. Well, that's takes a special person, I think,
Yes.
to be available
Not
at times
everybody
like
can
that.
do that.
Yeah.
And when you tell people what you do at a social event, that's a conversation stopper sometimes. Ooh.
Okay, moving right along.
But I tell people, most people just fall asleep.
Wow.
They just go to sleep and they stop breathing. And as a registered nurse, I know that.
Right.
So I'm aware that.
Less frightening for you
Yeah.
maybe than some.
Oh yeah.
Wow, that is a special time. It is. And then I'm going back to a comment that you made, just to clarify for viewers, which I think is important, is if a nursing home calls you. So we provide hospice care and hospice volunteers to a person at home wherever they call home.
Right.
So the hospice program has contracts with the nursing homes.
Yes.
So that if it's a VNA hospice patient that happens to be in the nursing home at that time of their life at the end, then we just go into that facility and take care of them with the same services.
Or even before that time of their life, too. I mean, towards the end. But,
Right.
but they may be able to sit and visit with you, but they are declining. And so you can visit with them then, just provide some companionship, because the nursing staff doesn't have time to do that.
Right.
No.
And you have a better understanding of it because of your history.
Yeah.
Yeah. What's the most rewarding part for you?
The thank you that you get every time you come, when they leave and go out and say thank you.
Oh, the caregivers.
And and then when you leave at the end of the visit, that they never forget to say thank you.
Nice.
And we're looking forward to you coming next week
yeah.
or whenever.
Yeah. So you must get to know patients a little bit.
Yes, if they are able to communicate.
Right.
Some are not, but yeah. And we reminisce with them about things in their past life, which sometimes, even if their short-term memory isn't good, sometimes the long-term memory is very good.
They say those memories, it's like a tree, the roots of those are deeper, so they're more solid.
Yeah.
And the more recent ones are the little roots that maybe blow away in the wind. Yeah.
And if they want to talk, then we will talk with them. But I always tell people, do not feel as if you have to entertain me. I always bring a book or a magazine, and if you want to do your crossword puzzle and watch TV, that's fine. I'll be in the other room.
Oh, yeah. Do you have people or patients that you visit that are looking for someone to play cards with, or?
There are some. Yeah, I'm not a card player, but I know.
Oh, yeah.
We do, or other games, yes.
Yeah.
Cribbage, right.
Cribbage?
So
Is that a biggie?
Yeah.
Gail, so you probably get that kind of call when they first schedule a volunteer.
Yes.
Yeah.
Do you get special
They
requests
call with their
for
requests, special requests,
Oh,
cribbage, cards.
Yeah.
Watching television, talking about sports or current events.
I think I had a story at one time we had a cigar smoking patient that had called the volunteer coordinator and said, "Do you suppose you could send somebody over that would smoke cigars with me?" And we had one of the volunteers said,
goodness.
"Sure, I'll do that." So
I can't do that.
we aim to accommodate whatever the requests are.
Yes.
Now, do you handle any of the physical needs of the patient?
No, we are hands off.
Hands off.
Certainly can get a cup of coffee or a glass of water if they need it, but just hand it to them.
Okay, just to clarify for people that all the hands-on care happens with the clinicians.
Yes.
And the volunteer is there for support, companionship, cover while the caregiver goes out.
Right.
Did you need any special qualifications for a hospice volunteer?
No.
No.
Just an interest in being able to listen to people and being compassionate. Being just wanting to help. Whatever required.
How about some of the other, I know as part of the hospice volunteer program, there are some individual special interest pieces,
Yes.
whether it's
Yes, we have volunteers who provide Reiki, which is a relaxation,
a complementary
a
therapy.
complementary
Yeah.
relaxation therapy.
Is that for patients and caregivers?
Patients and caregivers, yes.
Nice.
Yes. Yes, we have Reiki volunteers who do that. We also train some of our volunteers in Reiki if they're interested.
Oh,
We do
okay.
that about twice a year. And we have volunteers who are pet therapists. And we have
How many pets do we have? Just a
3.
few? Oh yeah.
Just getting
3.
started.
What size are they? Dogs?
They're dogs. They're none of them are very big.
Oh yeah.
And
So they're
they'll go into patients'
friendly
homes.
lap size.
Yes.
Yeah.
Some of them are lap size. Some of them are a little bit bigger,
little bit
but
bigger,
they're it's
That's very popular.
yes,
Yeah.
it's very popular.
Because it works so well.
And it then we also have volunteers in a program called Telling Our Stories, where volunteers go out and will sit with the patient, and they have a small recorder, and it may be 4 or 5 sessions depending on the situation, and the volunteers will interview the patient about their life stories and their memories and record it, and then they come back to the office and we transfer it to a CD for the patient and family.
Nice.
We have volunteers who are veterans who work with other veterans.
And there's a special training for that as well, is
Yes,
that right?
yes. There's an extra training with that.
Yeah. So as a volunteer for the vets, that's the requirement, is one be a vet themselves.
Well, it's helpful.
I would think, yeah.
Sometimes we've had retired social workers who worked with veterans.
Can we talk just briefly about what kind of impact does it make for the agency to have so many people volunteering, and how many do we have?
We have about 55 hospice volunteers,
Okay.
and it's a huge impact for the agency and for families. Families often can't afford 24-hour care. Not that the volunteers do any hands-on care, but they are a safe presence to allow the caregivers to get out, to go grocery shopping,
Right.
to the bank, the post office. And of course we encourage family member caregivers to get out and to have some time for themselves. They
Right.
typically don't want to, but we try to encourage them to do that.
Yeah.
And
So totally for the agency, what do we have, 130 something?
we have 100,
volunteers?
it varies, about 140 full-time volunteers.
Oh, yeah.
140 volunteers, not full-time, but volunteers.
Right. Do we have a sense of, I know annually we put some numbers together.
Yes, last year I think it was over 13,000 hours
Wow. Remarkable.
donated of time.
Yeah.
People donated.
Yep. We only have about 2 minutes left,
Okay.
believe it or not. So I wondered if there's anything about volunteering, or the different programs that we haven't touched on that you would like people to know. What would you say, and maybe from both of you, what would you say to any of the viewers who have considered volunteering, or maybe are on the fence of, oh, wow, I should think about doing that? What would turn them around to say, yes,
Well,
I'm going to call?
Call me and we can talk about it further, and I
Yeah.
can give them more information. We can talk about it.
Yeah.
Sometimes people have some hesitations or fears about volunteering in hospice, and we can talk about that further.
Good?
So call me and I'll give
Good.
you the lowdown.
Yeah.
What about you, Kay? What
Well,
would
I think
your
that
message?
we'd find a fit for everybody. I mean, we had some folks, teenagers that helped in the office that had some limited capacity for mental things, and they were just great at assembling things and taking a pile of things and putting them into here and assembling packets and whatnot, and that was just great for them. And I think that it helped with, sometimes high schools have community service things that they need to do.
Oh, were they actually
So they-
required to put some hours together?
Right.
Yeah.
So find a task that fits the ability, and so the secretaries in the office were very happy to have them.
Thrilled.
Yeah.
I'm sure,
yeah.
because that just is a time-consuming.
Yeah.
Yeah. Good.
So we'll find something for everybody.
And what's been your biggest reward, Kay, for volunteering?
Oh, I think some of the strong, in many cases women, but it doesn't have to be, but caregivers that were just incredible people. And they knew that they had to take care of themselves so that they could be there, as the airlines say, take the oxygen mask and put it on yourself first, and then, you know, because you can't take care of that person
Right,
if you're
good analogy.
all worn down.
Yeah.
So you need to take care of yourself, and you need to stay well, you need to eat right and things like that. But some of them have just been very inspirational, that the giving, the caregiving that they do for their spouse, or sometimes it's a friend.
Wow.
It depends.
Yep. Well, we're lucky to have people like
thank you.
that are helping out along the way.
I've enjoyed it.
Good, I'm glad. All right, well, thank you both for sharing all your knowledge and wisdom with us today. I appreciate your time.
Oh, you're welcome.
Yeah.
Thank you.
You're welcome.
Thank you for inviting us.
Yes.
You're
Yeah.
welcome. And I'm Jeanne Sarnosky, wishing you good health and good health care.